Okay, cool. So thank you everybody for joining DC Villages for our community conversation today, talking about DC's Brain Health Initiative. And I will hand it over now. So Kerritt, screen is yours.
Onward. All right. Thank you all so much for your time. Again, my name is Kerritt Saintal. I am the Brain Health Coordinator over at DC Health's Brain Health Initiative. And today I was given the great pleasure of going over what we have happening over in our Brain Health program. The aim is to try to give you all a pretty general overview of what the resources we provide, but then also we wanted to take some time to better understand what resources you all are looking for as well. So, as I said, the biggest points of this presentation are going to be focusing on memory loss in DC, a DC health overview, the overview of brain health initiatives specifically, some information and resources, and how you all can get involved as well. Right? Okay. So, for starters, let's talk data, right? That's what really kind of sells all of this. It's really what helps us to better understand the severity of the situation that we have at hand. So, how common are memory problems in the actual district? So, as of right now, you are seeing two graphics. I'll start off with the first one, the prevalence rate, which means the actual rate of occurrence of memory loss of, but what we call the technical term is subjective cognitive decline. And we've broken it down into several different categories. By males, it's 10%. Women, it's going to be 11%. And this is all within the residents over the ages of 45. Then it increases significantly amongst those who are 65 and older to experience subjective cognitive disorder, aka memory loss, with those who also have an additional chronic condition. So the importance of that, you can see vastly difference, the changes there in terms of how much more impactful it is to suffer from memory loss when you are experiencing an additional condition. And only 42% of those who are experiencing memory loss have actually talked to their doctors. And so what we're hoping by the end of this presentation is that we not only normalize the issue that is memory loss within the district, but we also feel free to talk about it, because healthy aging is something that is accessible, and we want it to be accessible to the residents of the district, but we can't help each other unless we know what we're going through. So that's the biggest part of this. That's one of the bigger parts of this issue, is us being very honest and feeling like we have trusted spaces to be honest about the memory loss that we are experiencing as we get older. And I have another graphic on here that really shows the prevalence rates or the frequency of occurrence of memory loss within the district broken down into wards. As you can see, the more darker shaded areas within the map of the district are those that are experiencing the highest prevalence rates. The lighter shaded ones are the ones experiencing the least prevalence rates. So right off the bat, you can see Ward 7, Ward 5, and Ward 8 are experiencing the most rates of memory loss within the district, comparison to Ward 3, which is only experiencing about 5.7%, while Ward 7 is experiencing 16.4%, just to kind of give you some context. Right? And so, obviously, with this being a big issue within the district, right, what we start to think about next is caregivers. What do the caregivers, those who are actually helping the residents that are experiencing these memory loss issues, what do they look like? Well, just to give you a good snapshot, about 1 in 5 adults in the district are caregivers, which means about 1 in 5 of, if you are around 5 or more people, about one of those 5 people are actually helping someone who is experiencing memory loss, just to give you that further context. So this is not just a you issue, but it's an us issue. Who are those caregivers? What do they look like? Typically, the majority of them are women. Um, about less than 15% are above the ages of 65 and older, which can potentially present some issues, right? 30% of those of that population of caregivers are caring for a parent. So a lot of the times it's children. Sometimes it could even be family friends as well, depending upon the nature of, the family dynamic, right? And then 6% of those caregivers are providing direct care to someone with dementia. So all of that to say, like I said, the issue of memory loss in the district is not solely an individual issue. It is a community issue. It's a communal issue. So the more that we know, the more that we're armed with, the more that we can help one another. So DC Health, where we come in. So this is just an overview of our overarching mission. What we want to do at DC Health is we want to be the healthiest city in America. And that sounds far-fetched and ambitious, but with us being the capital of the country, it just makes sense that our sights are set pretty high. But we want to be the healthiest city in the country. And so in doing that, we are doing our best to promote health, wellness, and just equitable access to resources, support, whatever that means to this residents of the district. We want to be able to provide that, because at the end of the day, us being able to make you all feel safe, make you all feel as if you have access to the resources that you need, that puts us that much closer to that goal of being the healthiest city in America. So these are a little bit like a snapshot of the strategies that we're implementing to help meet that goal. And it's kind of a three-pronged approach, but just for the sake of transparency and just making it clear, we just want to make sure that we are doing everything in our power to not only promote this within the culture of DC Health, but also within the district, a culture of health and wellness. We want to address the actual factors that impact your health, and not just when we say social determinants of health, we're really talking about the overarching factors, right? So not just you having access to a doctor, but also your environment. If you are in a safe area where you can, if you need to walk outside, you can walk outside, like looking at things like road safety. So it really is a holistic approach, which is why we have to address those different factors. We also want to really focus on strengthening our public and private partnerships. You are only as good as, I think there's like a phrase, especially people utilize it in marriage. Your husband is only as good as the wife supporting them. And I like to use that same type of idea with our partnerships. We are only as good as our relationships with other entities, with other networks, with other organizations that are also in the community doing the work as well. So we're really honing in and focusing on engaging with those partners, and not only just engaging, but including them in these processes when we start to think about producing solutions and results for the residents of the district, closing up any gaps between medicine and public health, and then making sure that any approach, program, or policy that we develop is backed by data. We do not want to create any type of programs or approaches based upon what we think. We want to have data that supports it. And that data is critical because that's what really shows us the accurate depiction of what's going on in the city. Now, Brain Health Initiative, that's where I come in. So essentially, Brain Health, our overarching goal is to promote, sorry, I'm trying to move the Zoom things around. It's to promote healthy aging and improve brain health among district residents. I think there is a common misconception that aging just comes with memory loss, right? That this significant subjective cognitive decline is just part of the aging process. But we want to make sure that one, we destroy that stigma because that's not the case. And two, that we do everything in our power to continue to improve brain health. And a lot of times, especially, just looking at it from the grand scheme of things, a lot of times people tend to focus on the younger populations in terms of just making sure that their health is maintained and taken care of. But health is important across the board, and aging happens across the board. The minute that you're born, you're aging, right? So it's important that we are doing everything that we can to continue to promote healthy aging, not just from the developmental part of it when we're born, but all throughout all stages of life. And I think that's where we're really trying to hone in on with our efforts, with our resources, with the different approaches that we're taking and interacting with residents and understanding what they need. We really want to make sure that we hone in on the fact that aging is happening to everyone and it affects everyone, not just the older population, but the younger ones as well. And so with that, like I said, we're increasing awareness and promoting brain health through and prevention throughout the entirety of the lifespan. We are really focused on improving the quality of life for residents who are currently living with dementia and or Alzheimer's, and their caregivers, right? Because I can't take care of anyone unless I take care of myself. So we really want to make sure that we take care of the caregivers, and then making sure that we assess the effectivity of these programs throughout the course of them being rolled out. So before, during, and after, making sure that they still align with what the residents of the district needs. Right. And so this is just a snapshot of what's been happening over at DC Brain Health. Starting in 2019, a law was brought into effect that essentially made my position possible. So without the incredible advocacy efforts of residents such as Dean Brenner and a whole coalition of others that really honed in on the importance and the need of a dementia services coordinator specifically focused on healthy aging, on brain health, on Alzheimer's and dementia and its impact on the residents of DC, I would not be here standing before you today with this presentation. So it's definitely a special shout out to all of those that have been working in the background and in the forefront of this effort. Once that rule was mandated by law, we established the Brain Health Initiative underneath the Cancer and Chronic Disease Prevention Bureau. And the reason for that was the prevention piece, right? And like I mentioned earlier in the presentation, a lot of the residents that are suffering with dementia and or Alzheimer's also have other chronic diseases. So it just made sense for us to house them in the same space. Also in 2019, DC Health, we funded GW's Institute of Brain Health and Dementia to pretty much to conduct a brain health needs assessment. And what that means is we paid GW to figure out what the residents need through surveys, through figuring out what resources were already there, what gaps were there, so we could help, once we produced that report, figure out where to start and what needed to be improved upon in terms of resources. Then in 2020, Council enacted the mandatory dementia training for direct care workers. Obviously, also what happened in 2020 was COVID. So we definitely had a strong halt because of just the, how the pandemic manifested for over the course of some years. But during that time, we continued to kind of plow away and establish different partnerships with different organizations by establishing the Brain Health Coalition, which is a advisory board that really focuses on brain health within the district. So that worked out really, really well. And then we introduced, in 2022, we created a website, which you all will see later on in this presentation, that shows all of the resources that are available that specifically focus on cognitive health, dementia prevention, and any other tailored resources that focuses on that. And then in 2023 and 2024, we launched the campaign. So there's been a lot of things happening over the course of these brief years, but the main point of this slide is just to show that we are working, and we are working for you based off of what we've been collecting. All right, one of the biggest things put out was the state plan. And the main goal of the state plan is just to minimize, decrease the number of adults that are suffering from memory loss, and then increasing those number of adults so that way they can report it to their doctors and provider. As I mentioned before, there is a big misconception when it comes to aging. A lot of times people think memory loss or significant memory loss is just part of the process, but it isn't. And we really want to make sure that that is relayed clearly. So that way, when things are happening, when that progression starts to come about, that it isn't much of an alarming issue to report that to your doc, that it isn't like a stumbling block or something that you have to keep to yourself. There should be a sense of transparency and trust to report that to your provider. And then also, we focus on increasing the number of district residents that are diagnosed, but we're not focusing on increasing the number of diagnosed patients. We're focused on connecting more of them to the resources. Many of you, if you're from the district, and this is something I learned over the course of being here for the past 8 years, there are a lot of great people doing incredibly amazing things to help the residents across the board. But the thing with DC is we have a lot of people, basically a lot of chefs in the kitchen, a lot of really great opportunities, a lot of really great resources. And sometimes people don't even know where to start, or they're not even aware of all of the resources that they have at their disposal. So we are serving as somewhat of a repository of all of those resources. So that way, if perchance you, a family member, a friend, turns out that they are suffering from Alzheimer's disease or any related dementias, when they go on our website, they know where to start. So that's a really big part of our efforts with our state plan. Brain health information, just giving you more. Again, this is just to kind of show that Alzheimer's disease is a huge issue in the district, and there are risks for it that we are commonly, interacting with and have experienced throughout the course of our lives or throughout the course of our families or friends' lives. Not exercising enough, smoking cigarettes, drinking, obesity, hypertension, diabetes, depression, hearing loss. These are all examples of risks for Alzheimer's disease and related dementia, which basically means if we can minimize, decrease, or completely eliminate smoking, excessively drinking, monitor and manage our hypertension, diabetes, monitor and manage our depression, and hearing loss, even obesity, then we can minimize the risk of developing Alzheimer's disease and related dementias. The goal is to keep our brains healthy. And a part of that, it's going to take a coalition of things to happen. It's not just a one size fits all type of solution. It's going to take a village. All right. And this is just another graphic, just really showing the 10 warning signs of dementia. As you can see, we have a few options: memory loss, having difficulty performing familiar tasks. And that's really the biggest part, right? Is the familiarity with, if you're seeing or noticing that you're struggling on things that you typically do, or if you're forgetting the typical routes that you take on a day-to-day basis, having issues with language, whether that's slurring or just forgetting words that you typically say, feeling a sense of disorientation when it comes to time and where you are, poor decreased judgment, problems keeping track of things, losing things when you typically know where they are on a normal basis, significant changes in your mood and behavior, struggling to just process information that you like visual information, right? Pictures or signs, things of that nature. Or you're sensing that you're out of nowhere withdrawing from social settings, from work, from your friends, from work friends. Those are all signs or warning signs of dementia, which basically means if you notice any of these things are happening, talk to your provider, talk to a trusted, family friend that you feel comfortable enough to take you to the provider to have that conversation. It's better that we catch these things early versus catching them far too late. Okay. So back to the risk. As I said, we know what is a risk. Now, what can we do to actually reduce it? Again, this is my favorite part of this. It takes a community, like I said. So because of the fact that it takes a community, for sure. Just saw your note, Mark. I will definitely share the slideshow. Because of the fact that it takes a community, I really want to implore the importance of the intergenerational part of this, right? Monitoring your blood pressure, eating the healthy meals, being physically active, maintaining healthy weights. Everyone, and I think everyone, counting myself, um, we all go through the same thing at the beginning of the year, right? We make these incredible resolution goals that we're going to lose the weight, we're going to quit smoking, we're going to stop drinking, we're going to be more active this year, right? And I don't know about you, but for me, there's a higher chance that I can maintain that goal if I have a partner or some sort of like accountability partner with me, helping me with those goals. So, all of these things that you're seeing here listed to control the blood pressure, to practice good sleeping habits, managing stress, all of those things are a lot easily and a lot more feasible to actually happen if you have a community behind you. It takes a village, and I'm going to keep reiterating that because your health is not just your health, it's our health, right? So all of these different activities, all these different methods, they're great to do, but know that you have a community that should be able to support you as well. And that's where some of the resources can come in if you feel like you don't have one, to help provide that extra sense of accountability to help reduce your overall risk for dementia. So the resources, which I've been talking about, or at least kind of mentioning in passing, like I said, first things first, the Brain Health website. This is the end all be all in terms of all of the resources that you can find within the district that are related to or in some shape or form impact our residents who are suffering from dementia, Alzheimer's, and any dementia related diseases. So when you go on to brainhealthdc.gov, you will find, just as you see in the snapshot, a variety of different tabs, but the service resources tab specifically will show you a map, and it'll also have a list right next to it. So if you are looking for something like assisted living, you'll see how many are available nearby, and it'll also show you a map kind of showing exactly where they're located. And it's like I said, with dementia and just any disease in general, it's not just the illness itself, it impacts your entire life. So you'll find services on there that you wouldn't actually really think should be on there, like legal services. That doesn't seem logical, but it's important when you really start to think about, if the severity of the Alzheimer's, and making sure that those residents are protected from a legal standpoint, if it comes to that. So it's a lot of different components that encompass someone's needs that's suffering from dementia and or Alzheimer's and dementia related diseases. And we've been really adamant about making sure that we look at the totality of the patient, of the resident that's going through or suffering from dementia. Right. Now, what's on the website? Like I said, we have a lot of different resources that you wouldn't really think about. The Emergency Food Assistance Program, as we mentioned earlier in the presentation, healthy eating is important. And we'd love to talk about balanced meals, but if you are in a situation where you don't even have adequate access to said meals, that's where some of these resources come in. We also have the Seniors Farmers Market Nutrition Program, the self-measured blood pressure monitoring, the Senior Oral Health Resources, Diabetes Prevention Program, Diabetes Self-Management, Healthy Corners. All of this to say, we are looking at the totality of the residents' needs, not simply just like someone suffering from dementia and funneling them to the provider. The provider can only do so much. And once you're outside of that office, you have to deal with the rest of life, right? So we want to make sure that we address all of the different components that will help either reduce or help you manage your dementia. All right. So the ads, which is one of my favorite parts. We worked tirelessly on these ads. We partnered with a vendor, and you've probably seen these ads maybe a couple of months ago. We've made some revisions since then. We actually had some really integral feedback from a DC resident about some of the ads that we had previously made. And we took their suggestions and made the revisions necessary because, as I said before, DC Health is only as good as our relationship with you all, right? We cannot be producing programs, policies if it does not reflect the actual need of the residents. So we've been really intentional about the conversations, about engaging and including the District of Columbia's residents' input, feedback, and needs when we're producing these types of programs, initiatives, and approaches. So as you can see, ad number 1, dementia can feel like a fog. You can find the website there, and it says find brain health and dementia resources at our website. There's a QR code that you can scan that'll directly link you to the website as well. And we also wanted to make sure that these ads reflected the diversity and richness and culture of the district as well. We also have a video that I'm hoping will play. Let me know if you can hear it. If not, can you hear it?
I'm not hearing audio on it.
I'm gonna try that one more time. Sorry, I have like 1,000 tabs. Okay. Current slide. All right. Going to move this and play.
Okay, so at school,
Living with Alzheimer's and dementia can feel like you're lost in a fog. At first, it's just a slight mist creeping in, clouding memories, and as time passes, a slight haze becomes heavy.
Mom, are you okay?
But with the support of a loved one and the care of professionals, the fog can be lifted. If you or a loved one is feeling lost, talk to your care provider and visit brainhealth.dc.gov to learn more and find support.
Okay.
Sorry. All right. So this is just a friendly reminder of some things that you can do to reduce your risk, staying physically active, and that could just be something as simple as a 10 to 15-minute walk a day as you can, or that could just be walking up the stairs, if possible, walking around the apartment, walking around the home, walking around the park, if you have access to one. Is really just the point is to stay active and, more importantly, consistently. Another thing that you could do is preventing or managing your diabetes. As we mentioned before, one of the resources was the diabetes self-monitoring program, which is accessible. You can find more information about that on our website. Managing your blood pressure, there was also a resource pertaining to that. Preventing or correcting hearing loss. Trying not to listen to things too loud. It's definitely a big part of that. Avoiding or minimizing or just eliminating altogether smoking and alcohol completely. And looking out for the signs, which I'll show that video towards the end. Make sure I get through it. So what can you do to help us, to help DC Health? As I mentioned, the Brain Health, the Brain Health website is the repository. This is the source for all of the resources, the information about Brain Health Initiative, the information about the Brain Health Coalition, which you are more than welcome to join if you see fit. You can definitely reach out to me about that. Brain Health materials, share our video, anything that we're posting on social media as well, related to dementia, related to Alzheimer's, related to this population, related to supporting caregivers. Any of that, if you are active on social media, please reshare our posts. We would be more than grateful for that activity as well. But the whole point of what you can do to help DC is we're here to help you. So anything that you do to continue to help us will, in extension, help us to continue to help you all as well. I cannot implore, as I said several times, that it takes a village. And DC Health, specifically, the Brain Health Initiative, wants to be a part of that village. So all of these resources that we have created and all the resources that we are continuing to create with your incredible feedback is all an example and honestly a testament of our dedication and our commitment to wanting to play a major role in that village for you all. So if you have any questions, feel free to bombard my email. It's at kerritt.saintal@dc.gov. If you have more general questions about brain health specifically, the initiative, what we're working on actively, how you can play a part, any needs that you find yourself requesting, feel free to email us at brainhealth@dc.gov. And as I mentioned before, our website. Check out our website. We are constantly updating, changing, adding things just to make sure that it reflects the most up-to-date and accurate needs of the residents in the district. So that's all I have for you all. Thank you all for your patience as I was dealing with some technical difficulties. And just thank you all for allowing us to play a role and to be a part of your village.
Thank you so much.
Thank you.
There are a couple of questions in the chat.
Yeah.
First one is, are there links to similar websites for other cities on the Brain Health Initiative webpage?
I'm not muted, right? Can you hear me?
No, you're not.
Okay.
We can hear you.
Okay, good. As far as similar, I know that there are, so let me backtrack. The dementia services coordinator role, the role that I am currently in, there are less than 20 of us in the country. With that being said, I'm sure that there are other websites that probably have brain health housed, into another collection of different chronic diseases, right? But as far as specific sites like this, I could definitely go back and identify those specific states. There are states that are doing exactly the same thing, but you're not going to find it across the board throughout all of the 50 states because this position is relatively nuanced and specific. And like I said, it really is because of the advocacy of DC residents like yourself that just continue to press on for it to become a mandated position. But there are other states doing similar work with similar sites. It's just not something that's happening in all 50 states in this nuanced particular way. But I could definitely follow up and look into which states are specifically doing it and provide that information through DC villages.
Juliana, that was your question. I see you've got your
Yeah.
hand up. Is there more?
Yeah, for sure.
So I was just going to explain. I was thinking, in terms of people that are moving or whether they have parents in
Yeah.
another state, where to easily maybe find resources to help people who don't necessarily live in the district or maybe even in the DMV area.
Yeah, absolutely. And that's a wonderful question. We're actually having those kinds of conversations. We have a really great relationship over at Virginia specifically right now, and also in Maryland, but we have been making some more strategic efforts to kind of tie that to kind of interwoven the resources that are happening over in Virginia and Maryland and in DC, because as you know, the DMV is a relative, the population tends to be transient. So you could work in DC but live in Maryland, or work in Maryland, live in Virginia, right? So it's important that we're all on the same page. So we're actively working on that. I actually had a meeting last week with someone over in Virginia and started to talk to them about, even the military population and better understanding what resources are provided to them, not just in Virginia, but just across the board related to dementia and Alzheimer's. So we're definitely having those conversations, and I appreciate you for bringing that up. And we're working towards really establishing a more comprehensive resources and services roadmap for you all, because like you said, the DMV it's relatively transient. You kind of it's interwoven, right? So there's no start and end for the DMV. So I definitely appreciate that being brought up.
Thank you. Another question that came up is, are police being taught how to deal with people with dementia? I don't know if your agency works with MPD or not, or...
That is a great question. I really wish I had a solid enough answer for you on that. I do not at the moment, but I can definitely do my part to start to dig into that and figure out what methods we could potentially or approaches we could essentially take to start having those conversations, because that is important. Obviously, and I don't know if this is where you were going, but in relation to a lot of the homeless population, that we know that a lot of them are either mentally ill or are dealing with some type of brain health condition. So it is integral that we do have those conversations and that they are also equipped. The dementia training that I mentioned earlier in the presentation, that is specific to direct care workers and also anyone that essentially interacts with a dementia patient. So that could be admin staff, that could be housekeeping, that could be a nurse, that could be someone just taking, attendance at a senior home, a hospital, or any type of facility of that nature. But with you bringing that up, that's definitely something that we should start to think about on how to make sure that we're doing everything that we can to make DC a more pro-healthy aging city across the board. So I'll definitely take that over to the rest of the team.
Awesome. Thank you.
No problem.
And there was a comment in the chat from Yaritza about a brain health medical practice serving doctors in the DMV. So people can see that in the chat. If anybody else has any questions, please feel free to throw it into the chat or maybe unmute yourself. We've got a little bit more time before our designated end time of noon. Anybody have anything?
Thank you, Yaritza, for sharing that. I appreciate it.
Yeah, thank you for this wonderful work.
Thank you.
Juliana, I see your
Yes.
hand up again.
Yeah, so I don't know me specifically, but are there any places where people can donate or volunteer if they're passionate about this issue?
That's such a wonderful question, Miss Juliana. Actually, our brain health advisory coalition would be a great place to start. We are actually in the process of picking back up our regular meetings with them. So I can definitely when I send this presentation, the slide deck, you'll also find information about, joining the Brain Health Coalition. Also on the website, you will find information about joining the Brain Health Coalition as well, to volunteer and work with any other organizations that are a part of our network to help with those efforts. Also, if you are aware of any other organizations that are doing great work that is related to brain health or dementia related as well, please feel free to let us know too, right? Because we only know what we know, and we can't really know what we don't, right? So the more that we know, the better. So if you do have any additional information about other smaller organizations or even larger organizations that are focused on residents suffering with dementia, residents suffering with Alzheimer's, or caregivers also tending to those residents, that would be wonderful, because that would be helpful for us and strengthening that network that we have for you all.
There was one question came to mind for me. I had a friend recently asking on Facebook if anyone knew of like online screening tools because they were worried about forgetting words and stuff. Are there links to that sort of thing on the brainhealthdc.gov website?
I can follow up with you on that, Carter. I don't know if that's your middle name. But I can, I didn't want to say the wrong name, but I can definitely follow up with you regarding that. That's a really great point. I can't confirm that at the moment, but I can follow up. And if it's not on the website, just know that it will be.
Thank you.
No problem. Thank you.
Yeah. Are there any other questions or comments or anything? There are a couple of people saying it was a great presentation, so I would second that and appreciate your time presenting this. Are you guys looking into accessible? Looks like your entrances for buildings.
Yes, we are closely working with the Department of Aging and Community Living. So a lot of the conversations and efforts that are done there, that's where a lot of the accessibility component would come in. And I think I just saw another question about, are there blood tests for dementia? If there are any organizations or partners that provide that, it would be found on the website. I can specifically look into that and follow up with the members of DC Villages to provide that answer. But for now, if we have any organizations that are part of that, we would definitely have access to those tests. I do know, though, that the blood test for dementia, and please correct me if I'm wrong, Yuritsa, because I've been trying to stay up to date on a lot of the different efforts that are being made from a research standpoint related to Alzheimer's and dementia. I know that that is a more recent,
Yes.
a more recent development. So I don't want to make any promises that we have that or any of our partners have that right now. But I do know that that's something that we're in this, realm are really excited about having access to. So more to follow about, the rollout of that. And if any of the partners that we currently have in our network have it, like I said, I can follow up with the members of DC Villages and confirm that for you all. Yeah, I know. It's hard to know what happens if you're not aware of it. So please feel free to reach out whenever you have a question related to dementia or Alzheimer's. We are trying, DC Health specifically, we are trying to do better with making ourselves more accessible to you all, whether that means via the mass media campaign, incredible opportunities like this to do presentations, or even just working with other partners that already work with you all. So Yuritsa, I will be following up with you very soon.
Yeah, absolutely.
Because I think there's definitely some opportunities there for you to join the Brain Health Coalition and for us to continue to work together to help support improved brain health in DC.
Okay. I'm not seeing other questions coming up right now, so thank you so much. This has been really awesome.
Thank
Really
you.
appreciate it, and fantastic information. Encourage everybody to definitely check out the website, look at the tools, the links, the resources there, and get involved. Also want to let people know on Thursday at 1 p.m. we're going to have another community conversation about election stress, which may be something that is of interest to folks. So check with your village for details or go to dcvillages.org/events and you can find the link there for it. And our community conversation in November, we're going to be looking at Medicare sign up time. So thank you, everybody. And thank you so much for participating. And thank you so much to DC Health for all the great work you guys do.
Yeah, thank you all for even making it that much of a privilege and an honor to do so. We are only as good as our community, so we want to make sure that we match you guys. So thank you for the opportunity.
Thank you.
Hope everybody has a great afternoon. Take care.
You as well. Have a good one. Bye.
Thanks.